For a long time, I learned how to do 2-screw MTP fusions, but I've always been concerned with patient compliance. I feel a certain security putting a plate on top of the MTP joint after a single screw fixation. So now with the MIS, I have both the compression of a single screw plus the added security of a plate, and I don't have to worry about patient compliance. And especially with the MIS procedure, they're going to have less pain. They're going to want to do more quicker. So I want to make sure they're able to do the more quicker, and they have the security of a plate plus the screw fixation. What I think makes her recovery exemplary is what minimally invasive surgery has opened up for us as surgeons. Instead of just having traditional foot surgery, which has a very long and protracted recovery, with minimally invasive procedures, the recovery is much more tolerable, and they go tell their friends, listen, foot surgery is not what it used to be. Although the fusion hasn't changed in 100 years technically, now they have an operation where the recovery isn't, oh my God, I'm having my foot operated on. I think the biggest learning curve for me was joint preparations, how much bone to take away with the burr, because I was concerned, first of all, would I be able to monitor how much cartilage I removed, and 2, not taking away too much bone. And after 2 or 3 cases, I had to feel how much bone I was removing, how much cartilage I was removing to preserve the bony structure and get the compression I need post-surgery. I've had a 3-year experience doing bunions with MIS surgery, and I've done a couple other procedures, MIS, and I've just seen the benefits to patients, and there's been no detriment to the healing process. So I thought if we can do an MTP fusion with an easier recovery for the patient, that'll have better patient initial outcomes and better satisfaction with my patients.